We need to think globally about healthy aging because it's predicted that by 2050 there will be 2 billion over 60s on the planet. And 80% of those older adults will be living in low and middle income countries. Across the board, this changing demographic is going to result in societal, health, economic impacts. And what makes this significant issue even more complex is that 75% of the world's countries have very little or no data on healthy aging. And that means that trying to monitor and evaluate progress towards what we consider to be indicators of healthy aging is really difficult. My name is Carolyn Gregg and I'm Professor of Musculoskeletal Aging and Health at the University of Birmingham. My overarching research interest is around helping older people maintain or improve their muscle health. In doing so, their physical independence. We know that life expectancy is increasing, but the issue is around health span. Health span is the number of years we can expect to live in good health. And what we find is that health span is not keeping pace with lifespan. For example, in the UK, for 65-year-olds, that disparity is around 16 years for men and 19 years for women. So think about it. If you're a woman, the latter 2 decades of your life could be spent in poor health, which is a real cause for concern. In terms of improving musculoskeletal health, the most powerful intervention that we have is exercise training, and specifically strength training or resistance training. And we have shown that even in quite frail older adults, their muscle can respond to strength training. It's hard to get a muscle to grow when it's older, but by training we can make it stronger, and we have shown that these improvements in strength can translate to improvements in functional ability, which is really good news. What we need to do is find out more about older adults' needs and priorities, and to do more research in terms of finding ways to and developing strategies to meet those needs and requirements in different cultures and contexts. What's feasible in one country may not be feasible in another country. So the tools and the techniques that we use could be very different. And that's why it's so important to do your research in country and work with older adults to develop these solutions locally. And this is what we're trying to do at the moment. So we're running workshops in a number of different low and middle income countries, in urban and rural settings, talking to older adults, talking to stakeholders, and we'll collate that data, and that will help us look at commonalities and differences across different cultures and help us to set a research agenda working with older people and working with our collaborators overseas. So what we face now is a big global challenge, but also an exciting opportunity to build global aging research groups and networks to develop the best ways to optimize health span in older adults and enable them to keep doing the things that they value for as long as possible.